Welcome to week 25 of your 40-week pregnancy journey. You have only 2 more weeks left in the second trimester, and it's probably dawned on you that you'll soon actually have to deliver this baby. That might be a little scary but also exciting because motherhood is always special. Your baby's development at week 25. At 25 weeks pregnant, baby is as big as a head of a cauliflower, measuring 13.6 inches in length and weighing nearly about 1.5 pounds. This week, your uterus is about the size of a soccer ball. This week, your baby's skin is turning pinker, but not because he's getting overheated. In fact, the amniotic fluid is perfectly climate controlled, keeping him at an always comfortable temperature. Instead, the skin is changing color because small blood vessels called capillaries are forming under the skin and filling with blood. Later this week, the blood vessels will also develop in your baby's lungs, bringing them one step closer to full maturity and one step closer to taking that first breath of fresh air. At 25 weeks pregnant, those lungs are still very much works in progress, though they are already beginning to produce surfactant, a substance that helps them expand with oxygen after the baby is born. The lungs are still too underdeveloped to sufficiently send oxygen to the bloodstream and release carbon dioxide when he or she exhales. While baby's nose has looked like a nose for a little while, the nostrils are now beginning to open. Your baby's auditory system is continuing to develop, and he or she may be able to distinguish your voice from others this week. The sonograph this week shows that the baby's heart beats around 130 to 160 beats per minute. Your common symptoms this week. Some of the symptoms which you may be experiencing during this week might include heartburn or indigestion, snoring, tingling hands, that is carpal tunnel syndrome, etc. But along with that, there are some new symptoms which you may experience during this week, such as number 1, symphysis pubis dysfunction. Symphysis pubis dysfunction or pelvic girdle pain happens when the ligaments that normally keep your pelvic bone aligned during the pregnancy become too relaxed and stretchy too soon before birth. The culprit behind SPD is the aptly named hormone relaxin, which makes your ligaments stretchy so your baby can ease his way into the world. Sometimes relaxin does its job too well, loosening the ligaments around your pelvic bone way before the baby is ready to come out, which causes instability in the pelvic joint. Number 2, your hair. Your hair may grow faster and fall out less, leaving you with thicker, longer tresses. Sometimes hair texture changes too, causing hair to become either drier or oilier than before. Number 3, your nails. You may notice changes in your nails too. For some, pregnancy hormones spur faster growing, stronger nails. Meanwhile, others find that their nails split and break more easily during pregnancy. So here are some self-care tips during this week. Some of the self-care tips which you should follow during this week might include number 1, hair removal. If you choose to remove new body hair growth, it's considered safe to shave, wax, or use topical hair removers. However, permanent hair removal treatments are not recommended during pregnancy. It's good that everything will return to normal within 6 months after you deliver your baby. Number 2, nail care. If your nails are brittle, keep them trimmed and avoid chemical nail polish and removers, which can further weaken the nails. Like hair changes, your nails should revert back to their pre-pregnancy status by the time your baby is about 6 months old. Number 3, preventing symphysis pubic dysfunction. There are some things you can do to ease your discomfort if you are suffering from this pregnancy symptom, including wear a pelvic support belt, do your Kegel and pelvic tilts, avoid triggers, that is sit down to get dressed and avoid heavy lifting and pushing, ask for pain relief if the pain is severe, ask your practitioner about pain relievers. Try to take comfort in knowing that this too is a temporary symptom and will likely disappear after you have your baby. So in the nutshell, here is your week 25 checklist. Continue taking prenatal vitamins. Continue drinking about 8 to 12 glasses of water a day to stay hydrated. Continue doing your Kegel exercises daily. Contact your health insurance carrier to learn about do's and take care of once the baby is here. Thank you. Please like, subscribe and share our YouTube channel The Voice of Woman and press the bell icon to stay tuned for the latest updates.